A lot of my patients who come in to seek a facelift consultation will put two fingers on the side of their face and push up and say, "This is all I want, doc. I don't care if you're 30, I don't care if you're 80. Do this," and you say, "This is all I want. Why is it so hard to do a facelift?" You're not alone. And you're also not unlike I was when I was a resident. Back in the, 10, 15 years ago, it wasn't uncommon to do these lifestyle lifts.
Hi, I'm Carol, and I'm 61, and I'm a lifestyle lift girl.
Or these lunchtime lifts where you would cut out skin in front of the ear under local anesthesia with minimal downtime, minimal bruising, minimal scarring, but yes, minimal result. So what makes a facelift so hard? Why can't we just keep it simple? If these questions perplex you as they do then stay tuned, watch this video, and in hopefully 5 minutes you'll have a much deeper understanding of facelift surgery. Hi everybody, I'm Dr. Jonathan Zelken, a board-certified plastic surgeon in Newport Beach, California. Today I want to talk about the facelift and why it's not just a skin-deep operation. What is it that makes a facelift so complex, and are we overthinking it with our deep, plane, and vertical restore? Are we putting patients at unnecessary risk by trying to do too much when all we need to do, doc, is lift my skin like this just a little bit? Why can't you just cut this out and close it? Yeah, these are the same things that definitely occupied my mind for years, and it takes more experience to understand why it is that we make the facelift operation intentionally more complex than we think it needs to be. So, to illustrate this concept, I want to introduce you to my friend Skully here. Skully is a plastic model of a facial skeleton. And Skully has an old side and a young side. It's kind of the yin and yang of facial skeleton models. But the old side is an illustration, is a model of what happens with facial aging. I'm talking about deflation, loss of tissue quality, and some tissue descent, soft tissue descent. So it's on all three levels. I'm not even talking about the bone yet, but yes, the bone changes as well. So imagine, as we age, our tissue quality gets worse because we're not using sunscreen religiously, we're aging normally. Our tissues in our face aren't necessarily getting bigger or smaller, but they're starting to descend downward and inward. That's called radial descent, and that's an inherent part of the aging process. And when all of these things happen, we get this sort of crepey skin envelope over our facial skeleton, which makes the contours of our facial skeleton more evident, which makes folds like the nasolabial fold and melolabial fold or marionette line more evident, and it makes the tissue easier to manipulate, to pull, to tighten. In contrast, the more youthful face is like a fondant on a cake. It's a thicker, more forgiving tissue envelope, and we see this in certain races as well, whereas Asian skin tends to be thicker and more forgiving. And this hides the contours of the face a little bit more subtly, but also there are less obvious wrinkles and furrows that form when you have a thicker, better quality tissue envelope. So why isn't it that we can't just tighten this so that side A looks like side B? If you do that, you can easily pull out some skin, more easily than you could, for example, with leather or a lens wipe. But when you do it, that tissue is friable. It can rip. And when it rips, you don't have the longevity. You don't have that strength of tissue to withstand pulling forces. So that is one reason why a simple skin-only facelift might look good for 2 months. It might look good for a year, but it will not stand the test of time.
Style lift takes only about an hour. See the difference immediately.
When this airs, I'm going to have a before party, and I'm going to get rid of all my old pictures.
Because the tissue envelope is not only unreliable, but it also can't definitively and for a lengthened period of time withstand the forces of gravity and time. The skin is the weakest organ in our body. It's also the largest. So If we don't do that, what else is the problem with just a skin-only facelift? Something that's simple, something that just models when I do this. Well, the other thing to consider is we have these rivets on point A, point B, and point C here. What are these clips? What do these represent? These are the cutaneous retaining ligaments. This is the mandible retaining ligament, the zygomatic retaining ligament, and then there's one around the eye called the orbicular retaining ligament. If you don't remove these, you can only pull so much and have a long-term effect. So this is why release of these structures is so important, and it's risky because alongside each of these rivets are important facial nerves. So it kind of stinks that you've got to put your own outcome at risk in a sense to get a better cosmetic outcome. But only if we release these cutaneous retaining ligaments, improve the tissue envelope with a higher quality substrate, and then pull, will we be able to hopefully restore that youth that you have on your other side of your face in this model, for example. And that is the idea of a deep plane facelift. It's also the idea of why we do significant undermining. We don't just elevate skin here, but we come all the way forward. It's the idea of putting somebody at more risk in the short term to enjoy a long-term benefit. So, in order to get from point A to point B, we not only need to tighten the skin, but we need to share the load on certain planes. You can't just rely on the skin alone, especially if you have compromised skin quality. It's going to tear, it's going to stretch, it's going to basically look like it did in 5 years or less. So we've got to improve tissue quality. For things like that, we have CO2 laser resurfacing, we have fat grafting to sort of augment and restore the tissue envelope, and we have, yes, tightening of the skin with good old-fashioned facelift maneuvers. The other thing that's really important is to understand that deep plane. By tightening the SMAS layer, which is underneath this layer, we are sharing the load on multiple levels and releasing, if executed appropriately, a lot of these ligaments. These ligaments that are retaining or acting as rivets between your chin, your eye socket, and your cheekbone that prevent adequate tightening. By releasing them, you get a more restorative result that lasts much longer. If you do it in the deep plane, great. If you do it in the superficial plane, that's fine as well. That ligament complex will extend from the periosteum, which is the leather-like covering of your bone, all the way to your skin, and it kind of fans out. So you can release it at any plane. Sometimes in a facelift, I'll release the mandible cutaneous ligament at the level of the subcutaneous layer, in the fat layer, whereas when I do a chin implant, I'm releasing it underneath the periosteum. Let's talk about that. My two favorite implants that I use are made out of silicone. Why do I use implants in a lot of facelifts? Is this an upsell? Why am I making a facelift more complex than it needs to be? There's a lot of reasons for this. One of the most obvious is existing bony insufficiency. So we say beauty is only skin deep, but really the way we look, our facial skeleton will define our ultimate appearance. Yes, fat counts. Yes, skin counts. These are easily modifiable things at the time of a facelift. The bone, not so much. And as we age, our mid-face starts to resorb and set back, and we get a little bit more of a concavity in our mid-face. And what that does is it leads to a deepening of the nasolabial fold, and that is a telltale sign of aging. So if we just try to, tighten things, it's still going to want to fall forward into this chasm. So an implant such as a peri-piriform implant, which is made out of silicone, can easily and reversibly be placed underneath the base of your nose. And by doing this, we are outsmarting the aging process by simply applying a very easy to apply prefabricated device to replicate a more youthful mid-facial skeleton. And this is not only for the aging face. There's a lot of people like me even who have congenital or pre-existing mid-facial hypoplasia and setback that an implant like the peri-piriform aperture implant will help correct. I'm talking really fast right now. You can tell I'm passionate about this. The other implant that I use even more frequently is the chin implant. And the chin implant conveniently is placed through the same incision that we use for a facelift. Through a submental approach, we could place this chin implant into a periosteal envelope that is created like a hand in glove fit. So it doesn't move anywhere, not with screws, nothing like that. I'll put a couple long-lasting sutures in there to secure it, but really meticulous pocket development is key to placing an implant in the right position. And when we do that, not only do we create a better sort of a tent draping for your jawline to really be featured, but if you have a set back chin, doing this will be cosmetically advantageous, but it will also be rejuvenating. The real special power of a chin implant is when you do create a pocket, you are undermining where the mandibular cutaneous ligaments live. And so you are releasing this rivet that is a source of all the evil. It's a source of marionette lines, and if you want to extend it further, it's also a source of the nasolabial fold, as our mid-facial soft tissues don't necessarily get smaller, but they definitely descend. So the point of a facelift, a smartly done facelift, even an early intervention facelift, is to not only treat signs of aging, but to prevent them from recurring. And I'm not even getting into the neck right now. In the face, it's about release of retaining ligaments. It's about restoring volume if and when volume is lost with things like fat grafting and implants, which come in many sizes and flavors, both silicone and out-of-porous polyethylene. And then the other thing, the thing that we all think about when we do a facelift is the skin tightening and or the SMAS layer tightening. You can't get results like this with my plastic model Skully here with a skin-only facelift. And if you get them, they're going to be short-lasting. As easy as it seems to simply cut out the redundant skin that you get when you do this, and it looks so good, the reality is that result's going to fail in a short period of time. So keep these in mind. Skin-only facelifts do have a role in my practice. I still offer them. They're good for certain people, but it is not an end-all solution, and you should be aware that the deep plane facelift and other techniques that you may have heard about are more powerful and more resilient because of what they are correcting, not because of a certain technique versus another. Every facelift needs to be addressed on an individual basis based on your unique goals and anatomy. Once you do that, then you can define a plan that addresses that for every patient, old or young. So chin implants may not be for you just because I like them in certain facelifts. They're not for everyone. If you have a question, you deserve an individual plan, and I would invite you to come in for a consultation. Furthermore, for those of you who are first watching me, please do subscribe, turn your notifications on. I would love to answer all your questions below, if and when I have time to do so, and I would love to make more videos on this topic. Have a great day. Thank you.
Except tape.